Welcome, everyone. We're so thankful that you've joined us this afternoon for Operation Parents webinar. Today, we're talking about helping youth navigate influence from nicotine pouches to the next trend. And we are beyond thrilled to welcome Dr. Bonnie Halpern-Felsher. She's a developmental psychologist with additional training in adolescent and young adult health. She's a professor in pediatrics in the Division of Adolescent Medicine at Stanford University. She's the founder and executive director, as many of you know, of the famous Stanford REACH Lab. She's been the recipient of many awards, with the most recent being the Joseph W. Cullen Award from the American Society of Preventative Oncology. She's also American Lung Association's Outstanding Mother of the Year, and this recognizes women who balance work and family and make a significant contribution to the American Lung Association's mission. She also received the Society for Research on Nicotine and Tobacco, the John Slade Award, and this one recognizes individuals whose research makes a significant impact on tobacco-related policy. And boy, has Bonnie done that. Thankfully, her passion and her research focus on understanding and reducing adolescent and young adult tobacco, marijuana, and other drug use. The research and advocacy work that she and her team have done are now included in over 250 publications. She's been instrumental in setting policy at local, state, and national level, as many of you in the prevention field know. She's a proud parent of a 26 and a 30-year-old, and we couldn't be more pleased that she was willing to come back and join us again today.
Thank you so much, Michelle, for that absolutely lovely introduction. And I'm so excited to be here and to speak with you all. I know wanted to give a little bit more information about our Stanford REACH Lab. And first of all, hello, everybody. So great to see you. Some of you, I can't see who's on the screen, but I think some of you I know and some of you I am getting to know. So welcome and thank you for joining us today. So I want to just give you a little bit more information about the Stanford REACH Lab. So REACH stands for Research and Education to Empower Adolescents and Young Adults to Choose Health. A lot cooler than the Halpern-Felsher Lab. So this lab was founded many years ago and is really active, as Michelle said, in doing research and translating the research to prevention, intervention, and policies. I'm surrounded by about 19 full-time people who are researchers, educators, public health professionals, graphic designers, and so on. We also have a public health lawyer and 2 adolescent medicine physicians and a psychiatrist specializing in addiction research and addiction medicine. Our accomplishments, we as a lab and myself have really led to many city, county, state, and federal level policies that for example, that get flavor bans, so get rid of flavors in tobacco products in cities and states. Very proud of that work. Doing some other work really helped bring about some other policies around cannabis as well. And our prevention curriculums that you'll hear more about at the end have reached over 6 million young people across the globe. We're not just based in the US, but across the globe. We're very, very excited about that. So let's get started. What are we going to learn today? I want to make sure that at the end of this talk, you understand how peers, parents, marketing, other factors are influencing young people regarding new as well as emerging substances. And we're going to particularly focus on nicotine pouches today. As you may know, other talks I've given have been focused more on vaping, cannabis, alcohol, other drugs. But today we're going to mostly focus on pouches. Want to make sure that you learn about the facts and the effects of nicotine pouches, really with the goal so that way you can talk about them with your children, with your students, with your patients, with whomever you interact. Want to make sure you understand what they are, how they work, and what you should know about them. and want to make sure that you strengthen your role as a trusted adult to help young people refuse these substances and feel comfortable coming to you with questions, curiosities, or concerns before making the choices that they might make around using nicotine pouches, but really any other substance that they might be thinking about using. All right, so let's start with this. Before I talk about nicotine pouches specifically, I want to talk about the idea of smokeless tobacco as a whole. So when we talk about smokeless tobacco, it is a tobacco product that is smokeless. You do not burn these products. You do not heat these products. They are generally tobacco leaves like you're seeing here that are loose leaf, or they might come in a little pouch and you put them in your mouth. And so we're talking about oral moist snuff or dip. You take a little bit of that. It comes in a can. Take a little bit of that and put it in your mouth and hold it in there. Chewing tobacco, the same idea. Snus is similar, but the tobacco product comes within these pouches that you're seeing there. On the left, you also see dry snuff. That is actually something you put in your nose and your nostrils to be able to get those effects. What are the effects? Similar to the buzzes that we might get from any nicotine or tobacco product. By the way, I'm going to say nicotine or tobacco fairly interchangeably. I want to make it clear that these tobacco products have nicotine, and nicotine generally derives from the tobacco plant. There's been a big push, unfortunately, in our world of the tobacco world, and particularly by the tobacco industry, to try to separate out nicotine from tobacco. And I'll talk more about that in a little bit. But this concept of, oh, it's just nicotine, it's not tobacco. Most nicotine is derived from the tobacco plant. Now, we do have synthetic nicotine, yes, but even the Food and Drug Administration considers that to still be a nicotine product or a tobacco product. So let's not buy into the rhetoric that it's just nicotine, it's not tobacco. They are really one and the same in a lot of ways. All right, so we're talking about smokeless tobacco products. You are getting a tremendous amount of nicotine into your body. Now, for the purposes of our talk, the good news is most young people are not using smokeless tobacco, chew, oral moist snuff, and so on. Having said that, we still are seeing some use. We're particularly seeing in rural communities and particularly amongst male. And in some of the work that we've done in rural Northern California, not far from where I live, a few hours away by car, we will see in some of the research we did that often it's fathers handing a can of moist snuff or something like Copenhagen down to their male children to continue that use pattern. But overall, we're not necessarily seeing a huge increase or uptick in these products. But let's talk about now oral nicotine. So these are newer products that have been on the market, not for very long, for a few years. And these products are not smokeless tobacco per se, although it's kind of the same idea, but they're oral nicotine. Generally, the nicotine is derived from tobacco, as I mentioned before, but sometimes it could be synthetic. I'm going to focus on the pouches, but I want to mention the other oral nicotine products so you're aware of them. And as parents, you could potentially, see these in your young people's backpacks, at home, whatever, so you're aware of what they look like. So first of all, nicotine toothpicks. So believe it or not, you can buy a nicotine toothpick. It looks just like a toothpick, but it has nicotine in there, and you put it in your mouth and you're sucking on it or rubbing it into your teeth. This is important to know because, again, young people can easily hide these products and you might not realize that it's a nicotine product. We also have things like strips, nicotine gum, and lozenges. Now, some people, and particularly adults, are using gums and lozenges to help get them off of cigarettes or other nicotine tobacco products. Absolutely. But I'm concerned about and talking about young people who are initiating with these products like I'll talk about that in a little bit, but like Lucy gum. So just be aware. All right. But let's focus the rest of this talk on these nicotine pouches. So you can see here what they look like, and I'll show you more about this. They look like little, almost like tea bags in a sense, but smaller, more rectangular. And they are white, unlike the other ones, snus, which tend to be more yellow. They are more white, but the idea is that the tobacco is taken out, but the nicotine is still there. And generally, not always, but generally the nicotine is derived from the tobacco plant. All right, so let's focus more on these. So what are they? So first of all, the brands. We've got Rogue, Velo, On, and Zyn. Zyn is arguably the most popular, and I would love to hear from you if you're aware of and seen these products, but arguably the most popular product seems to be Zyn, and that is the most popular in terms of what we hear from young people. It's also the most popular in terms of market share, and I'll show you a little bit more about that. But you can see there what happens. So you take that nicotine pouch, and let me go on and tell you a little more about the pouch and then how they're used. So it's that pillow that the nicotine, and it's not just nicotine, by the way, it's nitrosamines, it's flavorants, it's other chemicals. Nicotine pouches, and particularly Zyn, have not been on the market very long. So we're learning. This is the, fly the plane while you build it kind of situation. We as scientists, we as public health folks, we as preventionists are still learning about these products at the same time that we're trying to prevent use amongst young people. But we do know that pouch that they come in, it's a fiber pillow-like pouch that holds the nicotine powder, the flavor, and some acidity regulators and other ingredients, like I said, like nitrosamines and others. That casing itself is both synthetic and plant-based cellulose fiber. Now, each of those pouches has anywhere from 1.5, 16 or more milligrams of nicotine per pouch. Okay? Now, to put that in context for a second, a cigarette, one cigarette has about 8 milligrams of nicotine, but what you actually inhale or yield from it is about 1 to 1.5 milligrams of nicotine. If you were to smoke an entire pack of cigarettes, you'd get 20, 25 milligrams of nicotine. So one pouch can be as much as half of a pack of cigarettes. All right, huge amount of nicotine. Not only that, I think I showed it on the next slide, but I'll say it here. We know from our publications and others, and I'm happy, everything I talk about is free, happy to send you any papers. I give you my email at the end. Anything that we have, I'm happy to share with you. But from our publications and others, we're seeing that young people are using anywhere from 1 to 3 or 4 pouches at a time. That's a tremendous amount of nicotine. If you're using a Zyn comes in 3 and 6 milligrams, most popular. Usually they're using 6. If you're using 6 milligrams, that's 18 milligrams of nicotine at one time. Now, you don't absorb all of the 18 milligrams, but even if you got 10 to 12 milligrams at one time, again, you're talking almost half a pack of cigarettes worth of nicotine. And young people are doing this multiple times throughout the day. So we're very worried about high levels of nicotine. And we'll talk about the effects in a minute. Not only that, but the type of nicotine that's in there is a nicotine salt, a salt-based nicotine. This really became most popular and arguably patented by Juul, the e-cigarette company that came on the market in 2015. Juul really revolutionized the amount and style of nicotine, and they came out with this nicotine pouch idea. Not nicotine pouch, I'm sorry, salt-based nicotine. The idea is it's less acidic, it's less harsh, it's actually less alkalinic. So think for a second, we did a little math, let's do a little chemistry. Think about your litmus test, go back to that idea. So nicotine tends to be very alkalinic, very much on the basic caustic side. So there's a lot of throat hit, a lot of caustic, scratchy throat hit feeling that people get. What Juul did, and what we're seeing with the nicotine pouches again, is they added benzoic acid or salts to bring it more towards the acidic side, but really just towards neutral on that litmus test. Just enough to the middle where it doesn't feel as strong. It doesn't hurt your throat as much. It doesn't feel as caustic. So with these nicotine salts, the other problem is it delivers a very high, rapid peak of nicotine to the brain very quickly. So nic salts very quickly go to the brain, and therefore you're more likely to become addicted as well, particularly to the young developing brain. That nicotine that is within these nicotine pouches is absorbed very directly into the bloodstream very quickly through the oral mucosa, because again, you're placing it between your gum and your lip in your mouth. When young people are using multiple pouches, they call it sometimes upper decky. This has become the term, multiple pouches in your mouth at the same time, particularly in the upper gum and lip area. Typically, young people will leave these in for 20 to 30 minutes and then again use multiple pouches throughout the day. You can see on the right one of the publications we have in our lab, and we have more on another couple that we published and more coming. These pouches are marketed in very similar ways as what we've seen with e-cigarettes. They come in flavors, many flavors. They come in colors, they're subtle, and they're really easy to hide, which is not by accident, right? If we can hide these products from you as parents, you as teachers, you as school administrators, you as healthcare providers, it's easy for young people to use these products and get away with it. There's no smoke, there's no smell, things like that. All right, so let's talk about the rates of use of these products. So these are data from the federal government, from the National Youth Tobacco Survey. The good news is cigarette use has certainly gone down. That's the light blue bar. We can see that. The good news is across the country, we are well below 5% for cigarette use, depending on the demographics. That's the great news. E-cigarette use has certainly gone up. And we saw that particularly starting around 2017, that's when Juul became the most popular. A little sidebar, even though we're talking about pouches, a couple sidebars. First of all, e-cigarettes were not the reason why cigarette use went down. Please don't buy into that rhetoric either. Cigarette use amongst young people was going down for a good decade before we had e-cigarettes on the market. That was great. We did our public health work. We did our job. E-cigarettes came on the market and changed that and increased the percentage of young people who are addicted. I would also say, and think about it, and we could talk about this in the Q&A time, that a lot of times the rates that we're seeing for e-cigarettes are somewhere in the 5 to 7%. My lab goes to schools across the country all the time. And I will tell you, and again, curious your thoughts, that schools are telling me, no, it's more like 15 to 30 to 60% of young people who are vaping. Now, sometimes it's THC, sometimes it's nicotine, sometimes it's both, co-use of both products. But the national numbers say it's about 6%. You tell me if you agree. Pouch use has gone, we've only started collecting data at the federal level for pouches in 2021, went from about 0.8% of young people to about 1.4, 1.8%. My own data, though, show higher percentages of young people who have ever used nicotine pouches, closer to 10 to 20%, depending on how we look at the data. So again, there, it's hard to know. I think the rates are higher. I would not be here and you would not be here today if you were not concerned about adolescent use of these pouches. Now let's look at it by nicotine pouch sales, by volume and concentration. And the main reason why I want to show you this, I don't know if you can see my cursor, but is at the 6. These are the different milligrams at the bottom. The 6 milligram right now is the highest use that we've seen in 2022. The majority of people who are using pouches are using the 6 milligram. That's Zyn. That is the amount that we know. And we know from market share that it is Zyn. And then by flavors, as I said, you can get all kinds of flavors. In fact, unfortunately, I should have brought in the marketing on this. Zyn just came out with cocktail flavors, which is very concerning to me as well, because you can get your drink without the alcohol flavor within there, and young people are going to just unfortunately love that. But we know from some of the national data, these are not our data, but the national data, that the majority of people who are using pouches are using mint and menthol, as well as all other flavors. But mint and menthol seem to be the most popular. But in our own data, we're seeing all kinds of flavors being used. We know that young people want flavors. It's part of the reason we see this with e-cigarette data. We're seeing it with pouch data now. young people are drawn to the flavors, and then they get hooked by the amount of nicotine, and then they get sick by the rest of the ingredients. Depending on what state you're in California, and in full disclosure, I testified for this bill. We have Senate Bill 793, which got rid of flavored tobacco throughout the state, with a few exceptions. We need to keep flavors out of the hands of young people because they are firmly attracting our young people to use these. All right, so let's talk about health effects on these. Now, a huge caveat, we do not know or have enough research on the health effects of Zyn, on, Velo, Rogue, other nicotine pouches. They are still really, really new. Remember, it took, 50 years to figure out the health effects of cigarettes and to understand the cancer that cigarettes cause, the heart disease, and so on. We've only had pouches on the market for a little while. So some of the work that I'm going to talk about in the next few slides, some of the data really come from borrowing from what we know about nicotine in general, what we know about smokeless tobacco, the snus, the chew, the smokeless tobacco that I showed you at the first couple slides. We just don't know enough about pouches yet. But I don't want to wait 50 years to protect the health of our kids. It's important for us to talk about this now. So when we talk about smokeless tobacco in pouches, we get young people who say, well, at least it's, or adults, at least it's not a vape or a cigarette. Yeah, but it has as much nicotine in some ways. Or it's not a lot of nicotine. Yeah, it really is. Or a lot of people in my school are using them, so they seem cool, especially the flavors. So these are just some examples of quotes that we really need to be working against to help young people. Whenever something's popular, whenever something's cool, whenever something's flavorful, they think it's okay. And that's the uphill battle that we all have to help young people. But we also see people and young people saying, I don't want to become addicted to nicotine, or it's kind of gross that I have to spit it out. Now, you don't have to do spit with pouches like you do with smokeless tobacco. That's the one good thing about it. But you still have to take out this wet, gooey, sorry if you're eating lunch, this wet, gooey product out of your mouth while you're using it or when you're done. So it is pretty gross. And then I don't want to take too much and get sick. So our job is to demystify the incorrect perceptions that's on the left of this slide and highlight and capitalize on the concerns that young people have from the right side of this slide to try to prevent use. So one of the things to know, and I started talking about this, but I really want to emphasize, is oral nicotine is not safe in any form, We've been hearing more and more rhetoric coming around that people saying that nicotine is safe, especially if it's in a pouch form or if it's not inhaled or smoked. Nicotine is nicotine, no matter how it comes in. Now, it's different from the patch. That's different. It's not your pure nicotine. I'm talking about, patch if you're trying to quit. That's great. Go for it. Nicotine that's in nicotine and tobacco products like nicotine pouches is not safe. One single use, that single oral nicotine product, can easily equal several inhaled cigarettes worth of nicotine, as I said. These products that I'm talking about today are very high in nicotine. Don't buy into, well, at least it's not. We're talking about kids. We're talking about people under 25. We're talking about brain development. We're talking about hearts and lungs. We're talking about the health of young people. No matter what they're using, nicotine is not safe for their hearts, for their blood pressure, for their heart rate, for their brains, and so on. So please don't buy into the concepts that we've been hearing more recently of nicotine is protective. We've heard it. In 2020, we heard nicotine is protective of COVID, which a physician and I wrote an op-ed saying, no, that is not true. Please don't buy into that rhetoric, and I'm happy to talk about that more. So when we're talking about nicotine pouches, we are worried about nicotine addiction or dependence because of the developing brain. Our brains are developed till 25. We're so much more likely to become addicted when that's happening, we need to really protect our brains. We know that over time, when we change our brain, we change our cognition, our ability to think, we change learning and memory. It impacts impulse control. We already know young people are very impulsive when they're using nicotine and they're addicted. They will do anything to get that next hit, to get that next taste, to reduce their withdrawal symptoms. But we're also worried about gums and mental health. Nicotine has a tremendous effect on our mental health. Abdominal cramps and nausea from really swallowing, because you're still swallowing that nicotine. So these are just some of the things that we are very worried about when it comes to nicotine. Now, this slide is, as I gave the caveat a few slides ago, admittedly more what we know about smokeless tobacco. We don't know specifically about pouches, but I am worried because it's a similar mechanism. I am worried. Now, you may not have tar from tobacco, but you still have a lot of other chemicals. I am worried about tooth decay. I'm worried about cavities. I'm worried about shrinking gums, oral cancer. I'm worried about bad breath, throat cancer, and so on. Something that we really have to worry about over time. There's something called leukoplakia. These are the small white pouches in the mouth. We see this a lot with smokeless tobacco. So we don't know about this with nicotine pouches, but we're very worried that we're going to see the same thing. I remember talking to a young person who was using smokeless tobacco, and he said, oh yeah, I was getting these white lesions. So I just moved the the wad of smokeless tobacco to the other side. I mentioned this to my husband. My husband's an oncologist, and he said, oh gosh, I am so worried that young kid is already developing early or precancerous cells and precancerous lesions. So again, I don't know if we're going to see this with pouches, but we are very worried. Cardiovascular or heart health effects. This is from the nicotine, and we can see this easily with pouches. Elevating our blood pressure, causing inflammation, constricting blood vessels. What about stroke? We don't know. What about heart attacks? We don't know. It's too soon. But that tremendous amount of nicotine that's in these products is something that we would be worried about. Do you get the sense I'm worried about a lot of things with young people? And then cancer, like I said, we don't know, but we know from smokeless tobacco that because you're swallowing that huge amount of nicotine, nitrosamines and other things, that we are worried about cancers of the throat and gut. Just a little bit more here. I said a lot of that, so I won't go into it. All right, let's talk about marketing. The marketing of these products is out of control. Now, I want you to think about this, why you should not be really surprised. The current pouches that are on the market, Zyn, On, Velo, come from the same big tobacco companies that we're seeing with everything else. RJ Reynolds, who brings us Camel, brought us Velo. Altria, Marlboro, brings us On. And then Philip Morris, which is really Altria in a lot of ways, brought us Zyn. This is a slide that we have on our new website, our new curriculum that I'll tell you about in a little bit. I want young people to realize that these are the products brought to us by the same big tobacco company who also brought us Vuse, Juul, and other e-cigarettes. They're not trying to protect you as young people. They are trying to get you hooked. That is their job. The tobacco industry has kind of shied away from anything. They're going away from more and more away from the cigarette per se and trying to fill in their dollars with other products. So when I talk about marketing, there's something called Zynfluencers. Now, we unfortunately see more marketing for Zyn than anything else. Just like when you think about Q-tips instead of cotton swabs, or my husband calls them earlobe cleaners, earball cleaners, or tissues we call Kleenex, or Band-Aids. They're really not, that's the name brand, they're bandages. If you think about that, we had Juul instead of e-cigarettes. People were calling it Juul or Juuling because Juul became so popular. We now have Zyn with Zinfluencers. Zyn is the name brand that is so popular that's actually been branded as instead of saying pouches, people say Zyn. People call it things like Zinning, like jeweling, or Zinneroni, or Ziniverse, or Zimbabwe, or Zin Challenge, and Zinfluencers. And you could see this is just some of the many, many, many marketing ploys that are out there. We see it on TikTok, we see it on YouTube, we see it on other social media channels. Now, Zin's careful, and nicotine pouches overall are careful not to do their own marketing, but they are encouraging the marketing of others. And you could see that here. There have also been marketing for sales, like buy one, get one half off. Now, you're not allowed through the 2016 Tobacco Control Act, what was signed into law in 2009, and then enforced with all kinds of tobacco products, additional products in 2016. You're not allowed to give free samples. So instead, what the industry does is give two for one, or reduced, or coupons. And now we're also seeing that the more, sort of like when you collect bottles and you recycle them, you get 5 cents back a bottle or whatever. We're seeing that with other products, with Zyn as well. So you can use Zyn, collect the cans, and then go get a discount based on that. Young people are price sensitive. These discounts are attracting kids. They're not attracting adults as much. I mean, certainly we're all price sensitive, but young people are particularly price sensitive. So one of the things that we do have on our website that I want you to know about is it's called Don't Be Played. This is a video. We don't talk about Zyn or pouches per se. We talk about marketing overall and how the marketing of nicotine, tobacco, cannabis, alcohol, any other drugs is attracting and targeting young people. This is about 5-6 minute video that my lab produced. Please feel free to use this. We'll give you links later about where you can find it. It's all on our Stanford REACH Lab website. But this is one that you can certainly use to help young people be more empowered to refuse based on that marketing, and to be better at knowing, is that real marketing? Is that real information? Or is that something just trying to get me as a teenager or a young adult to use? All right. So how do we think about, what do we do now? How do we think about preventing first-time use or continued use of pouches or anything else? The reason why we say anything else is pouches is just the latest. We are seeing nonstop proliferation of tobacco products on the market. Who knows what's next? Those gums I mentioned to you, the nicotine toothpicks have not taken off, have not become popular, but they could. We're seeing e-cigarettes, just constant proliferation of new e-cigarette products, and so on and so on. So we see so much pressure for young people to use coming from all directions. Marketing on social media, peer pressures. And the peer pressure, by the way, is not like, come on, you need to use. The pressure is more like, everyone's using it. I think everyone's using it. So therefore, you should use it as well, or you feel like you should use it. We want to help young people build confidence to say no. Now, my lab says, rather than just say no, N-O, just say K-N-O-W. Let's get knowledge built in. And then use that knowledge to help young people say no. If you just teach kids to say no, N-O, without giving them the background, without helping them know how to say no, and without realizing that some people might already be using. So instead of teaching them no, we need to teach them to cut back and quit. We have a whole new set of videos called Staying True to You to help young people learn how to say no in a way that helps them save face. So you can check those out as well. But we want to help young people build that confidence to say no. It's not easy to say no as a teenager. Think back to when you were a teen and you had to say no to anything. It's hard. You feel ostracized. You have to save face. You feel like people are making fun of you. Everyone else is doing it. It's hard. So we want to give them the empowerment to make those healthier choices. And we also know that young people are so incredibly stressed out. And when they're stressed out, they're so much more likely to say yes to peer pressure. They're so much more likely to use drugs, period. We need to also help young people understand that drugs, nicotine, tobacco, anything, cannabis, and so on, is not the way to reduce their stress. It's not the way to help them cope. We need to give them other ways to do so and help them build strength to do so. Again, we've got some of those resources for you as well. Yep, come on. All right. So this is just one of the video I mentioned, Staying True to You. This really helps young people say no in a safe way. We've got elementary, middle, and high school versions. This is a really fun video. It's animated, and it takes people through 4 different scenarios with 4 different characters for each of the grade levels, and says, what would, Johnny's going through this situation. Pause. What would you do in this situation? And allows interaction, allows you to have some information, and stop the video. Either you can do it as a parent, as an educator, as a healthcare provider, anything. I always recommend play these in the background of your schools or in the school-based health clinics in the waiting room. This video, the other videos we have, play them. You can also do it one-on-one or in a classroom setting and pause it when it says pause. There are different pausing times throughout, and say, what would you do in this situation? Let's have that conversation. And let the youth run that conversation, not you, because sometimes young people need to be in control and need to teach us adults. We have a lot to learn from them. Let's listen and find out what suggestions they have, and then you fill in the holes and give them some additional suggestions. All right, it's time for a pop quiz. Everybody should play this. What is the minimum legal age to purchase e-cigarettes and cigarettes in the United States? And I think that is going to pop up.
Okay, I am not seeing it pop up, so could be missing something. Let's see. You want to continue on, Bonnie? I'm not seeing it pop.
Okay. All right, not a problem. All right, well, say it in your head, everyone. And then let me give you the answer. There you go. It is 21. So if you said 18, you're not alone. A lot of people do, but it is 21. It got signed into law. Let me just tell you a little more about that, and then I'll give you the research. It got signed into law at the federal level in December of 2019. So it does not matter what state you're in. If your state is 18 or 21, I think a couple states might be 19, your state has to follow the federal policy, which is 21. So if you did not know, you're not alone. My postdoc, Devin McCauley, and I have published 2 different papers over the past couple of years. This one just got published a few weeks ago, showing that the majority of parents, about more than half of parents, thought that the legal age was 18, did not know that it's 21. And the other study we published was for adolescents, young adults, and adults, and most of them did not realize that the legal age was 21. Why do I care about this? I care about this not because I care that people are following the law, although you should follow the laws, but more I care because of brains and brain development and that nicotine that we've been talking about for the last few minutes. We know that that teens are more susceptible to dependence. The longer we can wait, the further out we can go with their age to where they start using, the more we are protecting young people, the less likely they are to become addicted or dependent. I was part of the policy or the group that led to this policy, the Institute of Medicine. We wrote a report on this. And why not 25? Even though our brains continue to develop to 25, think in your head, what's the only group that was able to make a policy around 25? It's the car industry and the insurance industry. No one else really can do that. It's very paternalistic. It's very hard. Not only that, but our statistical models ran these huge statistical models that showed that if you make it rather than 18, if you make the law 19, you're not getting a lot of benefit for young people. If you make 21, you get a huge decrease in use and dependence. If you go to 25, it's not that different from 21 in terms of the net effects. So we thought the sweet spot was 21, and so that helped feed into and support the policy and the law. If you didn't know this, like I said, you're not alone. We on our website have posters like this one. We have a couple for parents, a couple for the general population, and a couple for youth to really help get the word out. I encourage you to do that, to get some campaigns going, to help get the word out to young people. And you could say, and we've got this on our website as well, we're going to build some more activities around this. So, hey son, hey daughter, how come it's not 25? Or why do you think it's 21 and not 18? Great opportunity for you to talk about protecting brains and protecting heart health and things like that, and lung health. It's also good if you're living in a state or in a community where a vape shop, a smoke shop, tobacco shop is selling to people under 21 or under 18, then you go educate them. So keep these in mind and use that as you wish. But that law makes me so frustrated when I see signs like this. On the left, this is about hookah. Saying, and we see this all the time for college nights, just bring your college ID. Or on the right, local and student discounts. The majority of people who are students are under 21. You graduated age 22 from college for the most part. Now, some of us, and I went on to many, many more years of education, some of you as well. I feel like I'm still in school since I'm a professor at a university, but the majority of young people who are students are under 21. These signs are attracting our kids. It's very frustrating. All right, so what can we do about this? And when we're seeing, well, one of the things, and there's another webinar by the Truth Initiative, which is great, is the Truth Initiative does have some programs and some coaching programs to help people quit all different nicotine products. I definitely recommend some of their opportunities for young people. I think they're fabulous. The other thing that I recommend, of course, now I'm going to recommend some things from my own REACH Lab, but again, this is all free. It's all freely online at the Stanford REACH Lab.com. This is our Becoming a Trusted Adult. This video, it's a 10 video, short videos. Each video is about 5 to 6 minutes. I'll show you what they look like. This is a little small, but that's what it looks like. There's a QR code if you want to look at it. It's on YouTube and on our website. These are each about 4 to 6 minute videos, total about an hour. It's not kid facing, it's adult facing. It's for parents, it's for healthcare providers, it's for teachers, it's for counselors. How do you learn how to talk to young people, do harm reduction? How do we talk to them about staying safe? Obviously, staying safe and harm reduction is not using it all, but if they are using, how do we get them to cut back and ultimately quit? How do we help them be safer? How do we do motivational interviewing? There's a great video that is between this one here, if you can see my cursor, between a counselor and a youth. Obviously, it's a script, but they're mirroring what motivational interviewing looks like. So please use this to become that trusted adult. So what can parents do? How can we help you do this? Well, one is look at that video. It's free. It's online. Become a trusted adult. And by the way, you can certainly look at it with your own children, with your teenagers. There's nothing wrong with that. Get their perspective. Okay, do you like it? Not like it? What else would you suggest I do? But again, it's mostly for you. Talk to your kids. They want to hear from you. Sometimes parents feel like, oh, my kid just turned 14 or whatever age, and they don't want my opinion. They don't want to talk to me. You know, as Michelle said, I'm a parent of a 26 and 30-year-old. I loved it last Saturday. My 26-year-old texted me, Mom, I really need your advice. And I was crying. You still need me. It was wonderful. Talk to your kids. Let them know that you're there for them. They may do the, I don't want to talk to you, talk to the hand kind of thing, but really they are listening. Sometimes just printing out a flyer. We've got a lot of free flyers on our website and leaving it on their bed or under their door. Maybe they're not talking to you, but you're communicating. Sometimes texting, I remember my kids are a lot older, right? But I remember when they came of age around the time of when texting was very, very popular, I thought, I thought, oh, I hate texting with my own kids, but I realized that was the way I was going to get their attention, particularly the younger one. So whatever it is, talk to them. Tell them that you care. Tell them that you care. It's not that you're trying to get them busted or in trouble. I would recommend not getting them in trouble for if they're using, but helping them. That's what we need to be doing with them. So talk often. Talk about what food they're going to have, what clothes they're going to wear, and talk about substances all in the same breath. Normalize. My lab says we don't want a confrontation. We don't want a lecture. We want a conversation, and we want to normalize that conversation. Talking to your kids is not going to have them go start using drugs. Talking to them will help them have that conversation, know that you care, and help them not use or stop. Don't perpetuate the myths that we're hearing that nicotine is okay, as I talked about a little bit ago. And then stay vigilant about new trends. You can follow us on social media. I have that at the end. Pay attention to what's going on, because unfortunately, all of us, including me, and this is what I do for a living, sometimes doesn't find out about a tobacco product, until it's already on the market and attracting our kids. So what can schools do? So also review the Becoming a Trusted Adult videos. Those are very much for schools, counselors, administrators, and so on. Also, don't perpetuate that myth that nicotine is okay. We are about to, in the REACH Lab, build some new either lessons, we haven't quite decided, infographics, videos, something where we're going to make it very clear that nicotine is nicotine in any form and is harmful to young people. Schools should also be aware of those new trends. I remember back in, 2013 or so, when e-cigarettes were first coming on the market and becoming popular, schools were calling me, and this was before the REACH Lab was really a thing, and saying, hey, Dr. Bonnie, I'm seeing these things plugged into the outlets, and what is it? It was great because they alerted me and I was able to teach them what they were, and we had a conversation. So be aware of what's going on. And then please do consider using our free curriculums and resources. We also do provide free trainings to schools. The only time we ever charge for schools is not schools. It might be a state or city or county if you want to create the whatever version of our curriculums just for your state. We are working with several states and counties to help them do the kind of concierge service of we're doing technical assistance, we're training everybody, we're creating the New York version, the California version, the Hawaii version. That's the only time we charge. But if you want to just pick them up and use, everything is free and everything is online and super easy to use. So regarding today's main topic of oral nicotine and smokeless tobacco, we did create, it's brand new, a curriculum called Not So Sweet. It is our Not So Sweet Oral Nicotine and Smokeless Tobacco Prevention curriculum. It's 2 lessons, particularly for middle and high school. It is evidence informed. It's not evaluated fully yet because it's brand new. It's literally just a few weeks old. This curriculum, the goals are to help for you as educators, to help adolescents and middle school and high school students identify the different types of smokeless tobacco and oral nicotine products, understand the health risks, help with refusals of those products, choose healthier alternatives to stress and coping than those drugs, and understand how the marketing has been really attracting young people. So this is lesson 1. It's called Bitter Taste. Lesson 1 focuses on the health risks of these products. I showed you a few of the slides in my talk were from that curriculum. And then the second lesson focuses on the media and the marketing techniques. This is something that we know works really well. If you tell young people you're being targeted, they're so much less likely to want to use. You tell young people the industry is just trying to get your money and trying to really manipulate you. It helps young people not use. And then we also have some flyers on our website, like this one here, that you can print, laminate, used throughout your schools, your clinics, and so on. We just ask for all of our curriculums that you please keep our logos on there. Make it clear that it came from the REACH Lab. We spend literally millions of dollars and thousands of hours to bring this to you for free. So please don't co-brand it or take it over as if it's yours. Use them as is. Again, if you want to talk about working together to create your specific versions, we're happy to do that. So what can communities do? Follow the Tobacco 21 laws that we talked about. Educate retailers, enforce the law. Make sure that I don't care if it's a 7-Eleven to a gas station to a tobacco or vape shop or a cannabis shop, the law is Tobacco 21. Follow the indoor smoke-free and nicotine laws. Let's try to get nicotine pouches in all of the nicotine and tobacco policies. You can't smoke, you can't vape indoors in a lot of communities and states. Let's try to include that for other products as well. Let's get rid of flavors. I know some adults say, but I need the flavors to quit smoking cigarettes. You don't. There are other ways, more effective, evidence-based ways to help adults quit smoking cigarettes. Let's not entice young people to use these new tobacco products. Reduce the nicotine levels. Right now, there is no ceiling, no top effect of how much nicotine is in there. And let's get rid of those ads. So here are some resources that are always great. I am on the PAVE board, the Parents Against Vaping E-Cigarettes. I am on their board. It's a great resource for parents. Truth Initiative, Campaign for Tobacco-Free Kids, another in Kentucky, and then always any quit lines are really great to be able to use. Our toolkits here, and I know we're running out of time, I'll just go through this a little bit quickly. We've got our tobacco prevention toolkit started in 2016. We've got, like I said, the not so sweet, but we also have You and Me Together Vape Free, hookah, cigarettes, and other resources for you there. We also have our cannabis prevention curriculum, Smart Talk. All these lessons have been about 45 to 50 minutes. We're now shortening them to be about 35 to 40 minutes per lesson. And then we have our Healthy Futures curriculum. This is my and our Healthy Futures. This is our cessation curriculum and alternative to suspension. So if you find students who are using in class, in school, or your own kids, you can refer them to the My or Our Healthy Futures. And again, we do free trainings on all these. All of our curriculums are or will be in Spanish. I mentioned the videos. Those are all on our website. We also have video on the brain and on box breathing. We have all those infographics I mentioned, not just, by the way, not just on nicotine, tobacco, cannabis, but also a lot of stuff on fentanyl, including some new fentanyl videos and a curriculum. Something cool that we just launched in the last few weeks is the fentanyl and opioid kit and the tobacco and environment kit. These are like campaigns. If you want to do in your school a full week of lessons and stickers and flyers and PSA announcements and social media, we wrote it out for you, free of charge. Just take these, follow along, use them. You could do one day or an entire week. We're going to be building a lot more of these kits in the near future. All of our curriculums, like I said, are evidence-based, and we have reached 6 million, not 5 million. All right. Follow us on our social medias. We would love that. We get a lot of negative comments by the tobacco and cannabis industry. It's always nice to have some positive. And there's our website if you want to sign up for our newsletter and anything else you need there. And then I think I'm handing it over to you, right, Michelle?
Yes. Now is a wonderful opportunity to input your questions in the chat. We've got several there already. I'm going to share a few additional resources. You've heard of many of the Bonnie's resources from the lab. We're going to give you just a couple more, and then I promise we're going to get right to your questions. So Bonnie, this slide is yours if you don't mind.
I do not mind. Sorry about that. So one of the things that I do, I love Operation Parent, and I love their parent handbook. One of the things I said is it's hard to be a parent and a young person today. I'm glad my kids are older. I don't know what I would do if I were in your situation. It's hard to be a parent of an adult kid. So we really need to be equipped together with accurate information on all of this information, whether it's tobacco, cannabis, other drugs, or anything else that Operation Parent addresses. So it's important to have this partnership between parents and children in order to thrive. So thank you.
It's so true. You said it a couple times throughout the presentation, and I know it's going to come up in the Q&A as well. Is we talked a lot about Zen today, and there's going to be a new substance like every other day. And so parents just having the tools and resources and ability to have ongoing conversations. And that's one of the things that's part of our philosophy with our handbooks. So we've developed a middle and high and an elementary version of our handbooks. And we believe, one of the hardest parts, one of the hardest parenting conversations, they don't come with a script. And that's exactly what Operation Parent created the handbooks to help with. Each one is grounded in evidence-based information and designed to help navigate the topics families are facing right now, anywhere from vaping to opioids to mental health. They're written for every trusted adult, parents, grandparents, foster parents, and kinship families. It's just practical guidance is what we try our best to offer. You're going to find conversation starters in our handbooks that just take the pressure off of, like I mentioned, there's a new substance every day. And one of my girlfriends said that to me recently. It feels like there's something new to talk about every single day. But it's not talking about a particular substance. It's just having that open dialogue and the conversations. But our handbooks are very up to date. Nikki updates them very, very often. And it just enables us to stay more confident and prepared for whatever comes down the pike, whatever new product it is. They're available in Spanish and Christian. And we couldn't be more proud of that handbook offering. You can use this pop-up to explore and get more information. We also have a bundle offer. If you want to think about getting a sample of the handbook, you can do that anytime at a really affordable price. We also have a Trends in Training event package, and we'd be really excited to talk with you about bringing this to your community. You can click the pop-up to learn more. It includes a step-by-step planning manual, promotional tools, very fun swag, drug fact posters, and it teaches kids about drugs, but most importantly, how to refuse and have confidence in refusing. This is our 20th year, Bonnie, so we're really excited to be celebrating our 20th anniversary and our work. For those on the call, we have a lot of folks on the call with us today, over 400. If we've made a difference for you, this is the year we want to hear your story. So maybe a webinar or a resource gave you the confidence to start an important conversation, and believe me, we want to hear about that. So if you could go you can use the QR code, or you can also let us know in the evaluation if you'd be willing to share a story with us. Let's keep those conversations going. Follow us on social media at Operation Parent is our handle on all platforms for tips, facts, and conversation starters that you as a parent can enjoy, or you can share them out with your community. And here's one more opportunity to register for our summer webinars. All right, now let's get to it. This question and answer section. I know one thing I wanted to start with is this is a conversation more than a question, but just letting the audience know that your team just hosted a very successful virtual conference. And Carol and myself on our team were able to attend that. And so I know a lot of folks come here first with their first dose of prevention if you're in the field. And so if you happen to miss that opportunity, we wanted to let you know there's still an opportunity to register for the conference. It was a 2-day conference. There were 5 or 6 presenters at each session, very high level presentations, excellent things to think about in our work as prevention or in our work as parenting. And so we're going to provide the link to the conference that you could still go back and attend that. There's not a reduced cost, but there is an opportunity that's still available. So Bonnie, if there's anything else you wanted to say about that, feel free.
Thank you, Michelle, for shouting that out. Yeah, so this is our 7th annual Cannabis and All Drug Conference, virtual conference. We had 76 workshops, 130 speakers, I think, 2,600 people registered and were on the conference. So like Michelle said, we have a lot of content, everything from the science around all the different drugs, including fentanyl, kratom, other things, all the way to preventions and interventions that you could use. So yes, it's not too late. It's $125 for 76 workshops and 2 keynotes that you can have. If you register, you have access to those for an entire year. We cannot sign you up for CMEs or CEUs. It's past the date for that, but the workshops are there for you if you are interested. So just register, shoot us an email, whatever, and we'll help you do that. So thank you.
Excellent. We bring it up also so you could put it on your tick list for next year. If that sounds interesting to you, you can ask Bonnie or I about it. We're happy to talk more. Okay, so I know the summertime, Bonnie, is when your team works on updating the curriculum. Would you be willing to give us a sneak peek about what's coming up next?
I would love to. I love talking about what we do because I love what we try to bring to you. So very appropriate for you. We are building a parent toolkit. We already have some resources on there, but we're going to be doing a lot more about parent conversations, becoming that trusted adult, a lot more information for parents to have conversations with their kids and kids to have parents or conversations with their parents as well. So that will be coming. We are revising, as I said briefly, all of our curriculums to be smaller, a little tighter in time. All of our curriculums either are or will be mapped to the national health standards by the middle of the summer. We are also building a new curriculum on kratom, which I'm very excited about. That will probably not be out till middle to late summer, but our goal is to have everything available by the start of the school year. So something on kratom. We're also doing a driving under the influence curriculum, and that's going to include cannabis, not just alcohol. We're doing a curriculum on athletes and how vaping, smoking can be harmful to your health if you're an athlete and slow down your athletic ability. We are doing a sex ed and substance use curriculum. And in fact, we already have a new video out on consent that's already on our website. So that will be coming as well. Like I said, we're going to be building some information about this new idea that, that nicotine's okay, which it's not. So we're going to do some information there. A lot more infographics, a lot more kits, a lot more information out there. Stickers, things like that. So endless information we hope to have for you.
Outstanding. That is going to be a great summer for the lab and for the upcoming school year. I wanted to let the audience know if kratom is something new to you and you want to learn more about that, you can go and do a backwatch in our webinar library, the January webinar with One Chance to Grow Up. We went pretty deep on cannabis as well as kratom. So if you'd like to spend some time on that, you could. And then here are a couple of the general questions. I know you said that the toothpick hasn't become very popular yet, but a parent did ask, is there any way to assess if it's a nicotine toothpick, or are you hearing any more about that product? I think they were curious about it.
It's a fabulous question, and I don't know much more about it. I'll be honest. I don't like to make stuff up if I don't know. So I don't really know. It might be time for me to go buy some and see what they look like. Not use them, but see what they look like. They might be a little bigger than other toothpicks, but I don't know yet. It's a good question. And Michelle, if I could save these questions, I'll work on some information for people.
Okay, sure. Yeah, we'll send them to you. What happens if someone swallows a nicotine pouch?
Yeah, to my knowledge, it hasn't happened, or at least we don't have data on it. But I would be very worried about, because then you're really absorbing the nicotine directly into the gut. Not to mention a choking hazard. I don't know to what extent it is absorbed in. What happens if you swallow it. But I worry about that cellulose fiber getting basically trapped. I don't know if you remove it through normal waste processing or not. So I don't recommend it if to swallow it. And again, we don't have data, but I would say that if swallowing does happen, that you certainly call Poison Control Center to see if there's something that you should be doing.
Can you remind us how teens are co-using the pouches with other products? What are you seeing there?
Yeah, it's a great question. We're unfortunately seeing or poly use of all kinds of products, both combination of nicotine and tobacco, as well as nicotine with cannabis. So with pouches, what our data are showing is that a lot of people who have used or are using pouches have used e-cigarettes already. So we don't know if they're using, what we don't know yet is, are they using the pouches to try to help them quit e-cigarettes, or are they using it just because it's a way to hide and they could use it in class, and then they use the vapes as they're driving home or on the streets or whatever. It's really hard to know exactly how the patterns of use. We're studying it. Other people are studying it, but we don't have a lot of information yet. But I will say that some young people, a good percentage, are on-ramping to nicotine and tobacco through pouches, meaning that is now becoming the first product they're using, not the second or third. I do worry about dual use, co-use, poly-use, because you are certainly getting even more nicotine. And then you're getting, we saw this with cigarettes and e-cigarettes. We saw people getting more nicotine. We also saw them getting even more of the chemicals that you would get from one product or another. We're also seeing poly use of cannabis and tobacco and nicotine. Nicotine's a stimulant. So if you are looking for that boost of your high that would come from cannabis, we're seeing a lot of times people are, taking a hit off of their THC vape or something or a joint, and then also using the pouch or e-cigarette together. And then that is enhancing their addiction as well, their dependence. So we're seeing this. And this is important, by the way, for all of you. If you're a parent or a counselor, educator, healthcare provider, whatever, when you're asking and you're screening and counseling for what young people are using, be really specific. Not, have you ever used an e-cigarette or have you ever vaped, but what have you vaped? Is it nicotine? Is it cannabis? Is it both? We know a lot of people are inhaling, say, half of a Juul or half of a Vuse or any other e-cigarette, nicotine e-cigarette, and then adding the cannabis oil. Or you can now vape melatonin and caffeine. You could pretty much vape anything. So finding out, what are you using? When you say, have you ever smoked? Smoked what? Have you ever used tobacco? Teens don't always consider pouches to be a tobacco product, even though I do. So being as specific as possible when you screen, counsel, and have these conversations.
Excellent advice. What about the co-use of the pouches and alcohol?
Don't have a lot of data on that. Now we know good news is alcohol's gone down amongst young people pretty significantly, but I don't have a lot of data. Actually, we probably do have data on it. We just haven't analyzed it yet, but I haven't seen big numbers on that to tell me one way or the other. I would not be surprised if we're seeing co-use, but I haven't seen it.
Got it. About how much nicotine is being absorbed from each pouch?
So the percentage, we don't have data on the exact percentage, but we know it's not all of it. So if you're using a 6 milligram pouch, you're probably not absorbing all 6 milligrams, but certainly a good chunk of it. So, but I don't have a number to say, is it 60% or 80% of it? Same, we know with cigarettes, you don't get all of it into your body. An 8 milligram cigarette, you get about 1.5. But realize that with a pouch, it's not smoldering or going in the air. If you put it in your mouth, you're probably getting a good percentage. So I generally think if you're using one pouch, 6 milligrams, maybe you're getting 4 milligrams, but we don't really know. Yeah. These are great questions. We just don't have a lot of data yet.
Yeah. I mean, it sounds like a lot to me. Like you're not, someone agreed they're seeing data saying that youth who vape are more likely to go on to smoke, but it didn't seem to show a rise in youth smoking alongside with high vaping rates. Is there a way to discuss this with people who are questioning that? So I don't know that I've done complete justice to that question, but I think what they really want to know, they're just kind of agreeing with what you said earlier. But whoever submitted, you're welcome to elaborate in the chat.
I think I understand what it's saying here. So, I think the question is, how do you have a conversation about it? One of the things that we say, I mean, when I first started our curriculums, our e-cigarette curriculum, we were the first or one of the first to have a e-cigarette prevention curriculum and then have a juul prevention curriculum in 2017, 2018. And we started in 2016 with our first e-cigarette curriculum. We got a lot of pushback, including from one of our funders, of how can you build this curriculum when you don't even know what's going on with it? We know enough. We can borrow. And you could have that conversation with young people. You can say, look, we don't have all the data, but remember it took 50 years to figure out about the harms of cigarettes. And it wasn't until the 1960s that we had the Surgeon General report. And it took, 20 something years after that to get this master settlement agreement. Takes time. Policies take time. Science takes time. So, dear Johnny, Sally, whatever, do we want to tempt that? Do we want to put something in our body that we don't know enough about? And that's how I would talk about it. And I would say, what do you think are the national numbers? What do you think, specifically to that question, what do you think are the rates of use amongst your friends? I always say to parents, don't ask your kids directly, are you using? That's a very awkward question, right? Mm-hmm. What I would say is, have you seen this in your environment? Is it something that you know about? What do you know? Hey, can we have a conversation about what do you know about pouches? What do you know about e-cigarettes? What do you know about alcohol? Can we go on the Stanford REACH Lab to look together? Can we go on the CDC or the NIH websites to look together? What is it that we could do together and learn? And again, wait and have your kids tell you, what do you call this? My kids laugh because I say pot still, and they always say, Mom, you're showing your age, it's weed. So, why do I call it cannabis and others call it marijuana? Have that conversation. Let your kids tell you first, and then go from there. And then you can also have a way to say, even though the data aren't all there, it's science. Can we talk a little bit about science? And now I don't want to get into a conversation of science isn't good. No, that's not my point. Science is accurate. But the point is that we don't always have all the numbers yet, but we still can borrow from what we do know and be very concerned. So hopefully, Michelle, that helps.
Very much so. And a perfect segue to our next question. So if I'm a parent and a user, how do I have the conversation with my child? How do you stage that? What are some of your suggestions?
It's always a harder one, and that's something we're going to be putting on our new parent toolkit soon. But a couple of things that I would say, first of all, is now it also depends if you're a parent who's using and wants to be using, and a parent who's using who doesn't want to be using. And I'm not judging either direction. I've had friends who have said, leave me alone, Bonnie. I know it might not be good for me, but it is my one thing that makes me relax, and I love using it. I'm not going to stop. I have a relative who said that too. I'm not going, I may not be able to change you on that. So it depends. But one of the things I would say is to say, look, I'm addicted, and I didn't start off wanting to be addicted. And I worry about you. I worry about your health. I worry about your heart, your lungs, your brain. You're still developing. I'm done being developed. I'm done, but you're not. And I really care about you. That's where I would go. I wouldn't say I've made a mistake. I wouldn't do stuff like that. But I would say that I am worried about you. I'm concerned about you. And young people hear that. They may not tell you they hear it, but they do hear it.
Yes. We want the best for our kids possible, the very best. So our final, it's kind of a point and a question. They're agreeing with what you said about the coupons. And this particular person was approached by reps at a gas station asking for me to share my ID, answer a survey, and then a coupon was handed over for 2 free cans of Zen. So completely agreeing and validating what you were saying earlier, and also showing just the presence of the products. Like everywhere you turn, and they're easy to get and easy to hide, especially the pouches. But I think that was one of our final points in the Q&A. It's been another lovely afternoon with you, Bonnie. We appreciate all of your knowledge and research that you've shared with us today, and the resources that you've already developed and those that are coming down the pike.
Thank you all so much. We are really here in this fight together. We are here to help you. Always reach out, whatever we can do to be of service to you. Happy to share anything that our lab does. And thank you, Michelle and Operation Parent, for all you do.
100%. We want parents to know that we've got your back. Whatever you need in terms of parenting, we're here to support you and give you hope and let you know we are all in this together. So I hope you'll lean on Bonnie and I and let us help you in your parenting journey or your professional journey in prevention. We'd be honored. So thank you for giving us your most valuable resource, your time, in the middle of the day or earlier if you're in Bonnie's area. And we look forward to seeing you on our future webinars and fighting this prevention fight together.